And finally, last Tuesday's earthquake in Haiti left some 300,000 people homeless. Many are clustering in public places without food, clean water, or sanitation. It's an environment that is ripe for the spread of communicable disease. Take a look.
Quake decimated Haiti's capital a week ago, but it's still a challenge to get medical care to the injured. Medicine and medical supplies, even sterile needles and thread to close wounds are urgently needed. Meanwhile, doctors are doing the best they can. Dr. Hassan is with Doctors Without Borders.
We have a shortage of equipment. We are doing what we can do. We have already done a lot. We have helped a number of injured, and we will continue to do so.
Help has been arriving. A U.S. aircraft carrier equipped with supplies, operating rooms, and water purifiers is anchored offshore. The challenge is to get supplies to where they are needed. International agencies estimate that up to 3 million people, a third of the population, may need emergency relief, a daunting task for any country, but especially an impoverished one like Haiti. Dr. John Andrews from the Pan American Health Organization says no one knows how many people need medical care.
In a city of 2 million people, thousands of people probably at this moment are in need of medical care. You can imagine when you see those photographs, those homes in rubble, trapped people, it's just very, very difficult to estimate.
A small number of the injured have been flown to the U.S. for treatment. Some have made it to hospitals across the border in the Dominican Republic or to other countries such as Jamaica. Crush injuries, head trauma, puncture wounds, burns, and broken bones require urgent critical care before blood clots develop or infections set in. Although bodies are decomposing on the streets, they are not a health threat. Health officials are more concerned about large numbers of people living in public spaces without clean water or sanitation.
I think the major focus will be the prevention of diarrheal diseases, the prevention of respiratory diseases, the link to trying to reinforce and prevent vaccine-preventable diseases.
Health experts are also concerned about hungry people eating contaminated food and that the weakened immune systems of so many malnourished people could make them even more vulnerable to disease.
We do hope things get better there in Haiti. Back to you guys.
Well, as always, thank you so much, Linord Moudou, for joining us. And for our audience, of course, Linord Moudou joins us every Tuesday and Thursday and always has the latest health news for everyone.
Wow, those images, you really can't, get used to seeing the deaths, the devastation there.
The devastation it's really hard to see, you know, when you see such extensive human suffering and so little that can be done to alleviate it, despite efforts.
Yeah, and the efforts, the outpouring of giving, we're seeing not only just people expressing their sympathies, but really people are giving from all over the world.
All over the world.
Yeah, individuals, groups, and that's encouraging.
Yesterday we heard, of course, from Sonny, he mentioned Pele and the Jamaican star, I forget his name.
The other one is Usain Bolt.
Usain Bolt, of course. Sprinter. And then also here in Washington, there have been a lot of efforts by Africans to help with the Haitian efforts. They've been going to the Haitian embassies, helping to either raise money or give donations of food, clothing, and everything. So obviously everybody's very, very touched by it. But is it enough?
It is, well, it's had, the tragedy itself it's beyond sometimes human imagination. The magnitude is big, but the empathy is there, and we hope it's going to continue to the rebuilding of Port-au-Prince. Well, for more information on these stories, go to voaafrica.com.